Welcome back. Now that the weather is warming up, many of us are spending more time outdoors. But are you being careful with your skin?
Well, May is Skin Cancer Awareness Month, and in tonight's Health News to Use, we meet a man who knows all too well the danger of the sun.
I've got a scar right up here from precancerous, had it frozen and removed.
Carl Behrens knows all too well the power of the sun.
Behind this ear, I've had most of the cartilage in the top of this ear removed.
So when he developed a red spot last year,
right on the bridge of my nose,
he turned to the physicians and surgeons where he works for testing. Cancer Treatment Centers of America in Tulsa.
and it came back as being invasive squamous cell carcinoma.
That's one of the more common skin cancers. Melanoma is more dangerous, though less common. With his red hair and fair skin, Carl is at greater risk for skin cancer. But it was his childhood that really set him up for trouble.
I spent a lot of time in the sun growing up, living on a farm in Kansas, so that's probably been the main issue, is the damage that was done when I was a child.
We know that 5 or more sunburns in your youth nearly doubles your risk of melanoma in your lifetime.
Dr. Rolla Eads is a plastic and reconstructive surgeon at CTCA who finds cases like Carl's are all too common.
Lots of people are outdoors enjoying the sun, but not knowing that that effect of the sun is actually damaging the DNA in their skin, and that damage is irreversible.
Dr. Eads says prevention is key. Wear hats, UV clothing and sunglasses. Sunscreen of 30 or more applied every 2 hours, more often if you're swimming or sweating. Carl Behrens does all that when he's outdoors and protects his grandchildren too, to prevent the sun damage that caused his cancer later in life.
But we didn't wear hats or caps as a child growing up, and certainly didn't use sunscreen in the late 50s, early 60s, so no, it never even dawned on anybody, I think, that back then.
Now, Dr. Eads says pay attention to any changes in your skin and don't ignore those changes. The earlier you get treatment, the better. Now, CTCA gave me a long list of sun protection advice, so we're putting it online for you at KJRH.com.